There. All right, everyone. So, Dr. Kave here again in the operating room. The first question that came up in this topic about emotions under anesthesia today was about spinals and epidurals and labor and delivery and all that, right? So, what happens to your body when you're pregnant? Well, a lot of things happen, right? Including lots of hormones that obviously affect your cognition. Maybe you've heard of like baby brain and all that. So, that compounds with what happens when you get anesthesia, right? You get all sorts of neurotropic and neuroactive chemicals. I mean, I'm holding one of them here in my hand, but there's all sorts of more. Right? I mean, I'm sure you've heard about the other ones here, ones that we typically don't give before anesthesia, before epidurals and C-sections, because we don't want to wipe mom's memory of the moment of childbirth. Also because these things cross, obviously, the blood-brain barrier, because they work on your brain, means they're going to cross the placental barrier and reach baby's blood-brain barrier and affect the baby, right? So you want to, if possible, avoid these medications unless you absolutely need them. There's a couple of times, hey Heidi, good to see you. In Chem 7, excellent. A couple of times you do want to use these things. It's actually life-saving to use these powerful medications, but it's pretty rare, especially around labor and delivery, which is what people want to talk about today, and the emotions and how to govern the emotions with medications like this. Good question came up about whether this can cause tachycardia. Typically, no. This is unique amongst our anesthetics, unlike this medication, for example. Unlike this medication, for example, don't have any heart effects. So no, it's not going to cause tachycardia. Great question. Now, when you're under general anesthesia, people think that your brain turns off. This couldn't be farther from the truth, because even though you're not awake, your body's still processing things. It's kind of like sleep, because when you're asleep, your brain is still doing all sorts of things, right? It's not just, sleeping with you. It's consolidating memories. It's healing your body. I mean, sleep is restorative, right? So under general anesthesia, it's not quite sleep, but it's still processing all sorts of memories. In fact, did you know that you can be fully unconscious, but you can still have memories of things? You don't even know what they necessarily are, but you still get bits and pieces from your environment. And you also process things that can lead to PTSD. So even if you're not awake, you legitimately are not awake, they'll tap on you and say, hey, Mr. Smith, Mrs. Smith, wake up. You won't wake up, but your brain is still kind of there. So this can be harnessed for good, right? When we have patients listen to clinical hypnosis-like tapes when they're under anesthesia, stuff that I actually provide for patients as well. I'll put it up on my website. If you haven't already seen it, I do have a link there for one clinical hypnosis recording that I have, free of charge for everyone, to listen to before surgery and even under surgery, because you listen to this stuff and it influences what your brain is doing. And your brain influences everything else in your body, like the monitor behind me, right? My heart rate, my oxygen saturation, all these things are influenced by my brain, right? So if you're liking this, remember to hit that like button, share with others, follow, subscribe, so I can do this more often for you guys, because I have so many stories to share and so many empowering things. Because notice that everything I'm saying right now doesn't involve the medications at all. No side effects with what I'm talking about. In fact, it's so powerful that there's a recent randomized clinical trial that went across multiple sites in Germany, getting at Germans as the most scientifically driven researchers in the world, maybe. And even they called it Dr. Strange. It's like, how is the brain processing things under general anesthesia? So the monitor is giving you anxiety. Oh my gosh, I don't want the monitor to give you anxiety. I want the monitor to show you guys how anxious or not anxious I am, or better yet, how much I've trained my brain and body to be relaxed, to have optimal heart rate variability without any medications. And this is like old science. It's not news per se, because we've known how to do this for thousands of years, right? So what else did we have? How can any forget the German did the name of science? Karen Badawi. I'm not talking about, I'm sorry, I was just saying Germany in terms of a research. Karen, please don't take this the wrong way. I'm not at all implying anything from the Second World War. I'm just saying that they have a robust pool of scientific literature, and that is what I was referring to. Please do not take that the wrong way. Absolutely not what I was getting at. So I'm just saying, you can look up this peer-reviewed paper. It was a multi-center randomized controlled trial. That is what I'm talking about here. Okay, So, Karen, I'm happy we got that taken care of. So, before delivering a baby, why is this stuff important? Because when you're, sorry guys, okay. Because when you're delivering a baby, you're not always under general anesthesia, right? You're usually, actually, maybe with nothing at all. Oh, I'm just looking at some questions here, guys. A lot of great questions. We'll talk about mental health and MH patients in a second. But before we get there, this is really cool because a lot of people don't realize this. So hit the follow button if you're learning something. Hit the like button because most women get their C-section with 0 sedation. You know, I've done, I want to say maybe 5% of the cases that I've ever done in labor and delivery for a C-section, legitimate surgery, you're being cut open, right? I've given 0 sedation IV, literally 0 sedation. I give a touch of this medication in the epidural space, a very, very, very small amount. But they're having full-on surgery with all the hormones that are just spiking up at childbirth with no sedation. And why is this important? Because it shows that you can have a full-on abdominal surgery, an absolutely invasive surgery with raging hormones, and you don't even need a drop of sedation. Why? Who wants to, I'm looking at the comments here, what do you think that this is like an extrapolatable event to others? Why do you think this is so cool? AW Ripper, no, my car alarm is not going off, not funny at all. What makes this so special about C-sections? Yes, chasing happy, I love what you're saying here. 3 C-sections with no sedation, but what makes the C-section different than other surgeries? It's not the progesterone. It's not the progesterone. It's because, all right, C-section with no sedation. No, we're talking about an epidural or a spinal. You have the epidural or spinal, but you don't have any sedation. Most patients for most surgeries do not tolerate. In my experience, which is like, you know, thousands and thousands and thousands of patients, I do nerve blocks all the time. The patients can't feel anything. We still go under general anesthesia, or we still give them at least some sedation, right? But for pregnant women, we don't do it. This is the take-home of today's talk. It's because women who are giving birth tend to have a discrete goal in mind. They've had 9 months thinking about this one particular goal. When that is your focus for 9 months, or maybe shorter if it's a preterm birth, doesn't matter. They know what they want, and they can undergo the stress of the surgery to get what they want. Now, this might sound obvious. You're saying, Dr. Cave, well, no, duh, I get it. But no, it's not that simple, because I've had, like I said, thousands and thousands of patients who come in for shoulder surgery. They know why they want shoulder surgery, because they can't throw a football. They can't lift up their kids. They can't do whatever it is that they want because of their torn rotator cuff. But I can do a nerve block for them, and they can be completely numb. And I've only done a handful, literally less than 5 shoulder surgeries on perfectly awake patients. But I've done hundreds and hundreds and hundreds of C-sections, if not thousands, on women without a drop of sedation. Do you guys see the difference? Do you guys see? Yeah, women are tough. I like that comment there. Women certainly can be tough, but anyone can be tough if they have the goal in mind. And that is the difference there. When you're coming in for run-of-the-mill surgery, you don't have 9 months leading up to something like this, right? Fundamentally different than if you have had a crystal clear goal about what you want. So this is extrapolatable to the rest of life, not just surgery, but obviously makes a big difference because I can measure the effect under surgery because I know exactly how much stuff I'm giving you. I know if I'm placing a breathing tube or not. Exactly, like someone says, it's about the drive leading to power. Absolutely. So if you guys are learning something, hit the follow button and subscribe, hit the like button and share with others because this is something that everyone can benefit from. Okay, so I'm looking at other comments. What I'm saying is that our brains have the power to cancel the pain off. Okay, so pain. We're not talking about pain right now. Great question. That's the one on YouTube here that I'm reading. Fantastic question. Remember, this is all going to be recorded up to YouTube after we're done here. So don't worry if you miss something. The brain does have incredible power over your pain perception, no question, because we know that open label pain placebos work. And we know that everyone experiences pain entirely differently, like our taste perception, right? There's no question that pain is 100% of the brain. But what I'm talking about isn't necessarily only for pain. It's for any type of, let me back up. It's not about pain, because when you're having the C-section, you're not feeling pain, but you can still have anxiety without pain, right? If you're having shoulder surgery, you're not going to feel anything that the surgeon's doing to your shoulder, because I've numbed your nerves above the shoulder. You won't feel a thing, which is why I've been able to do it with perfectly awake patients, right? But it's not about the pain, it's about the anxiety that prevents most patients from doing this. So while you can control the pain, you absolutely can. I'm not even talking about that today. I'm just talking about the anxiety, because we can block the pain for a short period of time. That's not a problem. Why is a spinal tap done without anesthesia? Very good question. It's the same thing here for like, why is the mom awake for the cesarean section, right? It's because, well, we want the patient to be awake, because if we're doing something that might be tickling a nerve, because we're placing a needle that looks a little bit like this one here, not too different from this one here, kind of close. It's a little bit thinner than that, but that needle's going in near some very powerful nerves. We want you to be awake so that if we get too close to a nerve, because we're doing this blind, I'm usually not doing this with an x-ray. I very, very, very rarely ever do this with an x-ray, especially if it's for an epidural. I don't want to, for a labor and delivery woman, I don't want to radiate a mom and her fetus, right? So I'm doing it blind. So I depend on an awake patient being able to verbally tell me if they feel a zing down their leg. Very, very important, right? That's why you do it under general anesthesia. You might pierce a nerve. You'll never know because the patient's completely knocked out. Great question. Great question. What else do we have on questions? I'm checking. Guys, like I said, this is all on YouTube, so I'm going to look through our YouTube questions as well. All right. All right, Shannon, I'm looking at your questions here. They're so good. I just can't get to all of them because there's so many all around. So please forgive me. I'm going to have to table those questions for a moment. But how did I decide on a specialty? Oh my gosh, that's a fun question. Well, we'll take a little break from the emotions under anesthesia and talk about why I chose anesthesia. Sure. Remember, I was an engineer before all this in Silicon Valley. I did, like the startup life when I was in medical school in Stanford. And I love solving big problems, no questions. But the biggest problem to solve of all was healthcare and the human body. So I went to medical school and finished medical school. I was kind of a little bit not too sure about finishing, truth be told. It was, I really wanted to get into the engineering world again. But I'm happy I did, because anesthesia is where it's at, where you're dealing with life and death situations where patients feel like they have no control, but they actually have incredible control, but they just don't know about it. And if they knew about it, they could reduce side effects, reduce incredible healthcare costs and bankruptcy, et cetera, et cetera. So it's like, it's not expensive solutions. It's not like Apple Watches and iPhones and whatever. This is like the stuff you've always had since the moment you were born, for the majority of humans at least, the potential to control all this. Anyways, I hope that answers your question. And if you guys are learning stuff, remember to hit the follow button and the like button and share with others. Your support means a lot. Sedation for an endoscopy. Why can't they knock me out? Another good question. All right, well, just a reminder, we were talking about emotions under anesthesia today, in particular about the epidural spinal process in labor and delivering women, and just how powerful drive and motivation is to beating anxiety. Not even pain, very important for pain, but for anxiety, because you are not even feeling the pain for those surgeries. It's the anxiety that's getting the best of you, but you can beat that. And pregnant women do it every single day, thousands and thousands of times a day. A lot of people can extrapolate to other parts of their life, including non-OB surgeries. But someone was asking about endoscopies. I do endoscopies, maybe like every couple weeks. I do a lot of GI, colonoscopies, endoscopies, like this one here, right? We use a lot of the white stuff, and we can knock you out fully. But usually in the United States, I don't know if you knew this, but anesthesiologists don't actually give anesthesia for endoscopies very often. Usually you have a nurse doing it, and they can't give knocking out medications. That's the reason why, just so you know. All right, someone's asking on about, what was this question here? This was about, there are a lot of chemistry in anesthesia. There is a lot of chemistry because we need to know how much of each of these medications to give, how fast it takes for them to come on and come off, how we can mix them, et cetera, et cetera. It's like a lot of mixology, or potion master is what I call it sometimes. All right, what else have we got for questions? Best thing. Okay, Shannon's asking here on YouTube, what is the best thing a patient can do to beat anxiety before surgery? So we already talked about, well, let me grab this. You can always beat anxiety with a medication like this, right? This is, I don't want to say it's the easy way out because I'm not saying it's bad. There are times when this medication is life-saving, no question about it. Because, and just so you know, the reason this is life-saving is that if someone's heart cannot tolerate general anesthesia, but we don't want them to be awake enough to remember the trauma, for example, of like a car hitting them and the surgery after that, we sometimes, right, we use this medication because it knocks out the memory formation without affecting the heart. Just so you know, actually, kind of a combination that we do in trauma surgery, there it is. It's actually kind of a two-hit thing. We give a lot of this medication. It's not anesthesia per se, it's not general anesthesia, but it's enough to scramble the memory so they're not awake to remember that trauma. Then we give this medication here because this one helps not depress the heart function. So even if you're bleeding out into trauma and it's like, you know, on a life or death, this is the safest thing to give, this medication here, in addition to scrambling the memories, if that makes sense. So anyways, this is one way to beat anxiety. Hey, by the way, if you are learning stuff, remember to hit that follow button, subscribe, and share with others, because Shannon asked me here on YouTube, how do we beat anxiety before surgery? So I'm sharing with you guys that it's not a letdown to get medications. Absolutely not a letdown when you need them. So even though I support natural therapies all the time, there's always a role for potent, even IV medications when you need them. It's what I do every day in the operating room. You've seen my little medication graveyard. I had like a whole bunch from my cases today. I mean, for goodness sakes, guys, I even had to use this guy today for something. If you guys know what this medication is here, this is, you can actually read the label if you want, right? Like, we will use medications when needed. I'm not saying to not use them. I'm saying you have to know when to use them. So, medications are one. Number two, your drive. If you know what you want, you can begin to set your expectations right. Because the classic anxiety setup before surgery is somebody who comes in and, I'm not kidding. Shannon, you asked a great question, right? Why are people anxious before surgery? It happens all the time. Usually they don't know what they want. Like, I'm not kidding. I have asked so many patients, why are you here today? They're like, I don't know. My doctor said something about my shoulder maybe. And I'm like, well, that's a problem, right? Because if you don't know what you want, if you don't know why you're having a life-changing event in your life, it's hard to prepare for it. And if you're not prepared, you cannot set your anxiety straight. It's very difficult, if not impossible. So you have to know what you want. And then, hey, Raider2 Rensaku, thank you so much for the comment. Raider tells me you are the first doctor that I like. Thank you for the kind comments. I appreciate it. So what I'm saying is you got to know what you want. Just like we said, for women who are delivering on the operating room table without a drop of sedation, nothing, and they're having abdominal surgery. Sure, they have an epidural or spinal, but it doesn't matter. They still have raging hormones from all this, but they're totally fine. In fact, many women cherish those couple of minutes when the baby's coming out. Why? Well, because they know what they want. For starters. Well, the second part to that is, can you obtain what you want? And this is where anxiety starts, because if you know what you want, but you can't obtain what you want, if you've watched my videos before, you know about the angle of anxiety that I talk about. I talk about it in my videos, which, by the way, if you check out the links in my bio there, you'll see that I am working on those videos. They will be available for you all to help you really crush surgery and crush life, for that matter. But the angle of anxiety is what happens when you can't obtain what you want, right? In the case of the epidural or C-section, I talk to my women before my patients, not my women, my patients, before the C-section, so they're crystal clear on what to expect from the epidural or spinal, from the whole L&D process. They know what to expect. They know what they want. There might be some anxiety, but that's anxiety that you can overcome. It's not the anxiety that I had with my patient yesterday that I was telling you about, who was so anxious and so self-medicated that I couldn't even do a nerve block safely in him before I did some clinical hypnosis, breath work and all that, connected him to the monitor just like I am now, and helped them descend from 50,000 feet down to like 20,000 feet. Huge difference. I hope you guys appreciate that. All right. Fantastic. So I hope everyone's learning something. Remember to hit that follow button and subscribe if you appreciate me coming in here at the end of a long day in the operating room in time for the weekend. Greetings from the Netherlands, BDD. I love it. Thank you. Damiano is asking on YouTube about, anesthesiologist as a specialty. That's a good one, but you definitely want to shadow anesthesiologists and talk with anesthesiologists before you make that decision. Shadowing is the most important thing, I promise, for y'all to take away. What is my specialty? I'm a board certified anesthesiologist. I went to Stanford for medical school and Harvard for residency, and I did a fellowship afterwards in integrative medicine. And that's why I'm here today, to talk to you guys about how you can avoid ever needing surgery, hopefully. All right, most surgeries in the United States are preventable, as are most cancer-related deaths and most chronic conditions in general. Kirsten's a CRNA on here. I love it. Fantastic. How does anesthesia work? Another very good question. This is on TikTok now. Well, we don't know how anesthesia works. And people that claim to say they know how, I can say, oh, the NMDA receptor agonism from this medication, for example, or the GABAergic agonism from this medication, for example. I mean, I can do this stuff all day, but I'm still hand waving. At the end of the day, I don't really know. What I can tell you, though, is that this stuff, which is our anesthesia gas, right? This is, a liquid. It comes in a liquid form that vaporizes into a gas, then you inhale it, yeah? We had no idea how it works, but it turns off the brain and the spinal cord. Literally just turns off the electrical activity. It's nuts. All right, and yes, Brooklyn, thank you for clarifying for everybody. There is no patient in here. I'm the one connected to the monitor. And because people tend to doubt this, let's do a very simple, I'm connected to it, but just so you guys can appreciate, one of the things that I always do with my patients before surgery, I connect them to a monitor. And just so you know, this is me. Check it out, guys. I'm going to demonstrate how, with practice, you can change your autonomic nervous system and your heart rate, variability of your heart rate. Is it succinylcholine, someone asks? No. I have an empty vial of succinylcholine here. I don't have it. I don't have it currently in the syringe. No. All right, back to the important stuff, guys. So what do I do with my patients before surgery when it's kind of like we got to get ourselves under control? Because if they go to sleep super anxious, they're going to wake up anxious. They're going to wake up with more side effects, more nausea. They might wake up with more pain, with chance of depression, frozen joints, surgical site infections, you name it, right? If I only have one tool in my toolbox, I have dozens, let's be real. Between aromatherapies, herbal therapies, other mind-body, I have dozens of tools. But if it's like the moment I got 2 minutes before surgery, like yesterday, I had less than 5 minutes, right? What did I do? I did my favorite breathing tube, right? My favorite breathing exercise, not my favorite breathing tube, pardon. Somebody left a comment here asking about my glide scope, and that's why I thought breathing tube when I was saying that. So, you're going to listen, right, as I demonstrate for you what I do for myself and what I do with patients in that last moment. They literally have the oxygen mask on their face. This is when, if they're going to be anxious, this is the time they're going to be anxious because they've now lost control. Their arms are splayed out, literally, on the table. They might be strapped down. And they feel like they've lost all control. What do you have control over, even in the moment when you've taken all control from you? What is it? What do we have? You can control your heart, your lungs, your diaphragm, and your brain. Even if you're strapped down, you can do all of that. Assuming you don't have a tracheostomy or something, right? Which is very rare. Regrettable, but very rare, fortunately. So, if you're appreciating this, I'm going to do this in a second here. Hit the like button, follow, and share with others, because it does help me support. It helps me do this more often. And there's so many things I'm planning for you guys. I hope you're all excited. But I'm going to show you now. What do I do? I ask the patients to breathe 100% oxygen. That's what any anesthesiologist does, to fill up your lungs with oxygen. In the process, I ask them to breathe with me 5 seconds in and 5 seconds out. It's breathing through the abdomen, not the chest. In fact, you can put your hand on your chest to make sure your chest does not move when you're doing this exercise. You're going to breathe. Now, you're not connected to a monitor. I am, so you can take it from me that what is my heart doing as I breathe in and out. So you can hear, this is the most accurate form of heart rate detection, right? The most accurate form. You're going to listen to my heart rate change as I breathe. Ready? Hey, Karen, I love it. Lifelong learner. Karen, I love it. So, Listen here. 1, 2, 3. So the alteration in the blood flow from that was so great, it actually messed up the pulse ox. That's the cool thing. Do you guys hear that? Did you guys see my pulse ox waveform on here? So what just happened, it's not just like changing heart rate variability. When you're breathing like that, you're actually shifting blood around your body. So let me do it one more time. If I drop my hand, I can minimize that amount of perturbation on the pulse ox so you can actually hear it. But just so you recognize, that artifact is actually a very powerful indicator for what I just did with my own heart, just by breathing. So, everyone can see my rhythm here. Let's go. 1, 2, 3. I'll do it again so you can hear the difference more. Did you guys hear that? Did you all hear that? That's just from the brain, right? Just from the brain and breathing through your diaphragm, right? No medications. I have no IVs in my arms, guys. People want to place IVs in me all the time. No IVs. I didn't give myself any beta blockers. That's just with the brain. So that's what I do with my patients before surgery, even if it's the only thing I got in my toolbox, because I only have a minute. I can't start whipping out valerian and ginger and lavender. I don't have time for that stuff anymore. All I got is one thing I can do. That's what I can do. So let's see. Okay, let's look at our comments here. Shannon says, your lives make the OR seem a lot less scary. Thank you so much, Shannon. I appreciate it. Dan G, I also appreciate your kind comments. Thank you so much. And Dawood wants to be an anesthesiologist and an intensivist. It's their dream. Well, I wish you the best of luck in that endeavor, Dawood. Excellent. Maybe last 5 minutes here before I go, just a quick reminder to hit the follow button or subscribe if you're liking this message here and you appreciate that you have more power over your body than you've ever been told. I also am putting more stuff on YouTube, so do check out the longer videos I put on there. I try to keep them under 5 minutes, but there's a little bit more in depth than what you see on TikTok. So still fun, hopefully lighthearted, but cool stuff that I think everyone can benefit from. So please check those out and share with others. Let's do a couple of last questions here. Well, I'll go to TikTok now to end. What are the questions that people want to see here? What about Wim Hof? He can create adrenaline on his own. Okay, guys, Wim Hof is awesome. I never met him, but some of my mentor, Andrew Weil, knows Wim Hof very well. I kind of need to meet him someday. I've spoken with most of my dream mentors. I haven't spoken with Wim Hof yet. Wim Hof is awesome, but Wim Hof, who's, by the way, done what I do on myself, like to the umpteenth level, Wim Hof shows all sorts of chemical changes in his body with his breathing. Now, I personally don't like to do Wim Hof breathing because you're increasing circulating levels of chemicals like this in the body, right? Now, this is, of course, life-saving, and if you need it, if you guys can't read the label, it's epinephrine, right? So you're increasing circulating levels of catecholamines in your body. Life-saving chemicals, no doubt. But usually, I want to lower the levels of circulating catecholamines unless I need them, right? It's kind of like a flight or fright response type thing, right? Flight-fright response. So this is life-saving, and I use it in the operating room at least a couple times a month. I don't like to, but sometimes you got to do it, right? And I try to avoid this circulating in my body more than it needs to. Wim Hof breathing helps increase the circulation so that your body can tap into that hidden potential. But if you don't need that potential, why go into it? Anyways, it's cool stuff. Wim Hof is awesome. Very, very good stuff. And I've tried it many times, but it's probably not necessary for most things. Okay. Someone's asking, why do you cry after anesthesia? Another good question. And I think we'll end with we'll end with this. Why do people cry under and after anesthesia? So did you know that people cry under anesthesia? Did you know that? People cry. People also cry after anesthesia as well. Why? Because people think, well, if I'm under anesthesia, I can't be processing emotions because I'm fully knocked out, right? Wrong. Absolutely wrong. Because when you're under anesthesia, your brain is still processing things. So what we started off this with, remember, this is all uploaded or will be uploaded on YouTube, so you can check out the full recording there if you missed any of this. And in fact, you know what? I'm gonna, because someone's asking about B12 here. It's gonna take too long to talk about this again. But suffice to say that you still have cognitive function processing in ways we don't fully understand. Even when you're supposedly asleep under general anesthesia, we hijack that system actually to help your recovery be better by giving you positive energy, positive vibes, and positive audio input. So listen to the first part of this if you missed that discussion earlier, but it's really powerful stuff. People are asking about B12. So maybe we'll end with B12 instead. So we're not repetitive here. B12 does get affected by the gases coming out of this ventilator here. This blue one, in fact, if you can see it, the blue one here is nitrous oxide, not nitric oxide, nitrous oxide. And nitrous oxide is a semi-okay anesthetic. It does cause more nausea, so I like to avoid it I'd much rather avoid giving the nitrous oxide in the first place than just, pounding somebody with this stuff at the end of the day, because why would I want to cause a problem and treat it rather than prevent the problem in the first place? So someone here says they get B12 injections every 3 months. Hazel, well, you're not alone. B12 deficiency is pretty common in certain populations, including people like me who are whole food plant-based. So I don't use it for that reason, also because it causes nausea. In the absence of nitrous oxide or laughing gas, you don't have to really worry about B12 metabolism. None of our agents really affect it all that much. Now, niacin's a different story. Niacin is not B12. It's another B vitamin that might be related to certain deliriums, or like people were asking earlier about crying under anesthesia being emotional anesthesia. So that could be something, right? But in the absence of that, it's typically not, if you're not getting nitrous oxide, not a big deal. So if you guys learned something, remember to hit that follow button. For those of you guys who like this stuff, I'm actually working out with the podcast company on getting, I'm going to be a host on, hopefully, on the Emotional Intelligence podcast in the next couple of weeks. So you'll see me there as well. But in the meantime, you know where to find me on TikTok and now more on YouTube as well. So you'll check out this video on YouTube if you missed the first part. Oh my gosh, I got to answer this question. Someone's asking, what is my profession? Please. Please. I'm a board-certified anesthesiologist and integrative medicine specialist. I went to medical school at Stanford and Harvard for residency. So that is my profession. Just to be clear, I would consider myself hopefully an expert that helps people, unlike some of the other people you see masquerading around on social media. So this is stuff that I use for patients every day, and you all can benefit from it as well, because you'll have more power over your health than you've probably ever been told. I look forward to seeing you guys hopefully on Monday, if not sooner. Take care, everyone. Remember to hit that follow button and like so that other people can learn as well. Take care. All right. Put this.